So today we're going to show you how to use the Bova multi-dose dropper bottle. So this bottle is preservative free with a closed system technology using the Novelia platform, which you can see here. So I'll turn this around, and this is the bottle upside down in that position. So you can see here, this is where the contents of the drops will sit in the closed system, eliminating the need for any preservative. So that just means that without a preservative, that is useful for conditions where preservatives can sometimes perpetuate the cycle of the clinical condition that the animal is actually being treated for in the first place. So this is a one-way system. So the drops, when you squeeze the bottle, the drops will come out of this hole here, which is here. And then air cannot pass back up this way. It's a one-way system, only that way. Air actually passes back through this way and is filtered back through the silicone membrane, keeping everything within the chamber sterile. So the dropper bottle will hold a contents of around 70 to 80 days worth of treatment, depending on what your vet prescribes. And the drops are also calibrated. So you'll find that the drops that you have coming out of this bottle are slightly smaller than the drops that you may be used to in previous bottles. So they're just calibrated to the size of what's more applicable to a dog's eye. So when you're using the dropper bottle, you would tip it upside down like this, and you can see no drops come out. You can give it a shake, nothing comes out. So it does require a degree of pressure. So I'm just going to drop this into some tissue so you can see. So when I'm going to squeeze it, you'll see that a drop comes out. And then also there's a half drop on there. So that's quite important because we don't want that drop sucked back into the bottle, because that now is contaminated to the environment. So when you're treating your patient, with the other videos, you just move across and then drop that second drop. It will get bigger when you squeeze it into the second eye. However, you still have that half drop on there, so you would just have some tissue ready after dropping it, and then just tap it into a bit of tissue like that before you tipping it upside down and putting the lid on. We don't recommend that you touch the top of the bottle because that will contaminate the lid as well. And then just recap the bottle, and then you're ready for next time.